So, this company, Pharmanex, was started in 1995 by the former director of medicinal chemistry for Merck. Michael Chang actually developed and discovered the first statin, which came from red yeast rice, which led to the discovery of Mevacor. Joe Chang invented a few drugs called Lodine and Rapamune, and then Carl Djerassi invented the birth control pill. So these scientists were experts in pharma at drug discovery. They understood natural medicine probably more than anybody because they had researched about 50,000 plant samples during their careers. And what they had discovered was that the natural compounds were often and usually working better than the drugs, but the drug companies won't produce natural things because you can't patent it. So they wanted to really bring this data to market because the natural data was showing it was better when it was produced right. And when they looked at the vitamin supplement market, to them, it was just a bunch of snake oil. Nobody was doing the standards that they were used to seeing in pharma. So they raised $40 million in VC funding in 1995 to start their own company. It was the largest nutraceutical startup ever. And they were applying pharmaceutical standards in their knowledge base to really develop this product line. They were originally in about 40,000 pharmacies. So it was a retail model. And then they were looking for a better way of educating consumers. Retail is very hard to differentiate your product. It's really just a price and packaging play. And so Merck tried to buy them in 98 for 130 million. Monsanto tried to buy them and they didn't want to go back where they started. And so there was a skincare company called New Skin Enterprises, which was a direct sales company. And they were doing about 500 million in sales at the time. So they had a lot of cash flow to invest, and they were looking to expand their research engine. They bought Pharmanex as a wholly owned subsidiary, ran it through a direct sales model or word of mouth model. And when that happened, their first month, they tenfolded the distribution that was being done in those 40,000 pharmacies. So word of mouth advertising, or this, they had almost like a network marketing type of approach. It's one of the most misunderstood business models, but when it's done right, we all know word of mouth advertising is the best form of advertising out there. And that's why this company was able to grow tenfold their first month over those pharmacies. So they continued to grow the company in that fashion to about $1 billion. And recently, they built this new innovation center here. So this building here was a $150 million investment. 2 floors of this is a lab. So it's the most advanced lab in the nutraceutical and skincare space in the world, looking at anti-aging. This is their main corporate tower, and this on the left is our distributor center. So these buildings were all designed by the same architects that did the Apple buildings. This company invested $150 million in these buildings recently. It was all paid for in cash. So there's no mortgage or anything like that. This is a very financially sound company. They own and operate all of these buildings here. This is another new facility they built in Asia, which is a $50 million facility. So what happened was when that acquisition took place, about 5 years later, they then came across this scanner technology, and they thought that this would be a great tool to be able to demonstrate that their products worked. So they were originally going to go through to their existing sales force, word of mouth advertising. And when I came on board with some colleagues, we really looked at the business a little different. We thought that we could start to go into healthcare. Let's go where we could scan as many people as possible, because we know the more people we're going to scan, the more opportunities there are to tell people about the benefits of the product. And where else is the best place but a healthcare office or a health club or a spa, places that have huge traffic where people are interested in their health. So in the beginning, we started going to chiropractors and spas and so forth, and we had a lot of success in that model. We couldn't go into medicine because Nu Skin did not have the medical rights, because that wasn't where they were looking to go with the technology. And 14 years ago, medicine didn't really care too much about nutrition. Things have changed a lot since I've been involved with the company, and if you look at any of the functional medicine conferences, the anti-aging conferences, those are where the physicians are happy, they're enjoying themselves, they're making money, and that's where a lot of the movement is. The flow of money right now in healthcare and in our economy is going towards wellness and anti-aging, and we're perfectly positioned in front of that. So we had the foresight to see that 14 years ago, And when the Pharmanex and Newskin did their reports to see the sales of the devices that were out there, when we started, the most productive ones were in the hands of the people that we were placing them in through our healthcare model. And so we started to get some interest in medicine back then, and we eventually convinced them to get the medical rights to the device, and that opened up the doors for us to place these in medical offices. The rest of their sales force really did not have the contacts, credibility, or resources to grow in medicine. And so they really gave up on this program and they went to market some of the easier products that the average person can sell, such as skincare and so forth. And then we then formed a brand called Healthcare Alliance, and we figured out all the tools and presentations and so forth and strategies to really take this into medicine and set up a whole new distribution channel for this technology and product line. And we've ramped this up to about 2,000 devices right now. And we're looking, again, like I said, to grow this to about 50,000 initially. So a little bit about Newskin. This is a company that's been in business 33 years. They're in 54 markets. They've got over $1 billion in assets. They're investing $60 million in R&D every single year. They're the fifth most trusted company according to Forbes, and they are publicly traded on the New York Stock Exchange. So applications to this technology is almost any type of specialty because, we talked about antioxidants play a role in so many health conditions. And so you've got a very diverse group of physicians that you can go and talk to. So what I'm going to do is if you guys have any questions about the science or anything I spoke about so far, just feel free to send a message in the chat and I'll either reply to your message or see if I can unmute you. But what I'll do here is show you some of the revenue models, both the revenue model for the doctors and then the revenue model for you. So the investment for the physician to get started with this program is $3,400. When they make that investment, you as the rep, you get paid $1,100 to $1,400 off the top. 1,000 of it you earn within the first 48 hours. So you can make some money really quickly with this. But what you can also do is generate residuals. And I'm going to go over some of the averages that many of our reps are making. So what we'll do is we'll talk, number one, about the things that drive this revenue spreadsheet is the number of scans the doctors do. So in this model, we said they're going to do 10 scans a day. Clinically, they should be testing everybody. And in this model, we're going to say they're going to charge $20 for the scan. We found that $20 is really a sweet spot. It's a number that brings in cash revenue into the office right away so they can get an ROI. But it also is something that is very affordable to patients. So we're going to say here in this scenario, they're going to test 10 patients a day. 2 of those patients are going to go on the supplements. We're going to put the average order as $100 a month, and we'll build in an attrition rate. And the cool thing here is we can even do a profit share for the staff and build that in too. So in this scenario, the doctor's going to do 200 scans a month. They're going to put 40 patients a month on product, and that's going to do 4,000 in volume. Over the course of a year, at the end of a year, they're going to have 359 patients that are receiving these products on a monthly basis. We're building in attrition here, and that's going to be 35,000 in volume. So the doctor, month one, we're just going to kind of go down to the bottom here. They're going to make their money back and net $700. So they basically got an ROI in 3 weeks. I don't know any medical technology you can ROI that quickly. Month number 2, they're going to make $5,600. And by the time they get to month number 12, they're going to make $14,000 that month, which is over $100,000 their first year. And we have physicians that are doing this already. And so we know that these are realistic figures. We have physicians that are doing higher than this. We have some that are doing low. You're always going to have physicians that are non-performers for whatever reason. It's not unlike anything else. But these give you a good idea of the numbers. So then most of our reps, there's a couple ways to get involved. If you want to just market the scanners and help the offices get up and running, then you can make a residual of 10% of their gross sales forever. If you want to get involved in more of a building a distribution channel and bring in reps underneath you, then we can go over how that works as well. There's an opportunity to do that too. So in this scenario, your first month, you're going to make $400 from this account, $800. By the time you get the month 12, this account's worth $3,500 for that month alone. And so let's say you had 10 accounts like this, you're generating $430,000 in annual commissions from 10 accounts that are averaging 359 patients on product. And so that gives you kind of a sense on how that works. And you can put as many of these devices out there. You're not limited geographically. Once you do get an account on board, that account goes under contract with the manufacturer. Everything is paid from the manufacturer to the doctor as well as to you. You don't have to track anything. You don't have to ship anything. You don't have to worry about paying your reps. It's all handled by the manufacturer. So it's a very seamless program. And once those accounts are acquired by you, they are protected accounts from the manufacturer. And you can expand this anywhere in the country, wherever your referrals or contacts take you. You're not limited to a geographic region. So that's how this works here. If you guys want to, if any of you want to get into any of the tiers of income, if you want to bring reps underneath you, I can show you how that works. Just